causes of cancers are multifactorial. There is no certain cause we can pinpoint that can contribute to development of certain cancer, although there are strong links between certain cancers and exposure to certain factors. However, some patients will develop cancer and others won't. So some researchers contribute the cancer development to failure of immune system, because the immune system has a capacity to repair damage incurred by DNA or remove the cancerous cells. However, we still don't know why some people respond to factors that cause cancer and others don't. Progression of the cancer after the initiation of the exposure can be rather rapid, and depending on diagnostic techniques, of course early diagnostic is always favorable, but depending on diagnostic technique, the treatment may be delayed. And one of the main points here that diagnostic should be performed early, and suspicion for cancers should be treated with all seriousness, and those patients should be evaluated and assessed as thoroughly as possible. Also, of course, we have our screening methods. So if recovery occurs after the treatment from cancer, we do not use the word cure, of course, and we're using word remission. Unfortunately, some cancer will result in terminal outcome, and at that point, we need to think about facilitating the end-of-life measures and initiating hospice care. There are many causes of cancer. Chemical carcinogens are present everywhere, and some of them have industrial origin, such as asbestos is very well known, linked to lung cancer, and nickel was causing cancer for industrial workers. Hormones are linked to development of certain cancers, such as prostate and breast cancer, and estrogen production in female can lead, excessive estrogen production, of course, can lead to the cancer of breast and uterus. Prostate cancers are testosterone dependent, and one of the treatment for, or one of the palliative treatments to slow it down or even inhibit is estrogen treatment and halting the testosterone production. But again, these are the two of the best examples, estrogen and testosterone, and then their correlation to the cancers. Radiation is another cause for cancer, and when we're talking about radiation, we know about ultraviolet exposure. The ultraviolet exposure can result in skin cancers. We need to remember here that skin cancers can develop differently. In case of basal and squamous cell carcinomas, it's the cumulative damage occurred over the years, while malignant melanoma, the most dangerous type, is occurring secondary to blistering sunburns incurred in childhood. So the bottom line, encourage your patients to use the protection, especially in pediatric populations where the prevention can truly result in elimination of the cancer further in the life. Viruses can be another cause for cancer, and the best example is human papillomavirus and correlation to it of it to cervical cancer. And genetic predisposition may play significant role in developing the cancer. Again, as it was said before, some people may develop cancer being exposed to exactly same factors, while others will not have cancer development. Cancer prevention is an important topic in healthcare nowadays, and one of the easiest ways to prevent it is to avoid carcinogens. Carcinogens can be detected as industrial carcinogens as well as environmental, such as smoking. Although there is no strong link with alcohol, but with some cancers, alcohol certainly can play a role. As it was said, skin protection may play a role in cancer development. Also, avoiding air polluted regions may prevent development of the cancer further in the life. Another important topic is the hormone therapy and its effect on development of cancer. It's important if you are, let's say, using contraception or hormone replacement therapy for your patient, is to adjust the therapy to minimal effective one, because increase in hormone therapy may certainly reflect in incidence of cancer. Calorie intake and exercise, these two go together, and I won't be boring you with the details, but body fat can contribute to chronic inflammation, and chronic inflammation may result in cancers of many different types. Screening is important. There are proven screening techniques and there are questionable ones, and there is major revision of screening techniques. Still, mammograms, self-breast examinations are one of those valued techniques, while nowadays the screening for prostate cancer with digital rectal exam becoming more of an archaic, non-effective way of screening. And we'll talk about this while we're talking about those disorders in further meetings. Colonoscopy is another effective way to screen for colon cancers, and the results certainly visible nowadays, which reflects reduction in colon cancer rates overall in population. Monthly examinations important in cancer prevention, and this involves breast exam and testicular exams. At the same time, regular checkups like pap smears for females and prostate exams for males. Again, it's becoming questionable practice nowadays, and it's not encouraged anymore. Rectal examination for males and females may be of lesser value nowadays, considering the limitations of those exams. However, colonoscopy for screening purposes is certainly one of the greatest. However, colonoscopy for screening purposes is one of the greatest tools. So, frequency of cancer is an important consideration. It's still second leading cause of death. Gender effect is important to consider because some males are affected by certain cancers while females are affected by other cancers. Again, prostate and breast cancer. Lung cancer used to be male-dominated disease. However, the shift nowadays is towards female population developing more cancer. It's the reflection of overall reduction of smoking rates among male population. Age contributing factor to cancers. And for instance, there is a statement about prostate cancer that every man may develop prostate cancer depending how long they live. So with age, you certainly may develop cancers. However, some people don't live that long. Most common cancers, again, as we talked in the beginning, breast cancer for women and prostate cancer for men, and also colon cancer. Frequency of cancer is different for male and female patients, and on this slide I want to show you frequency for general population, and by frequency we mean the occurrence of cancer. So this shows the most common cancers, excluding skin cancers, which are the most common ones, and the most common type of cancers is basal and squamous cell carcinomas, which are very treatable because they are visible on the surface and they are slow growing, and the excision or surgical treatment removal is very, very beneficial and has good good remission rate. So this type of procedures can be done, of course, in physician's office, dermatologists, or depends on the practice, and usually again have good success rate. Malignant melanoma is, as I was saying, it's a deadly skin form cancer, and approximately 1% of all skin malignancies will be malignant melanoma. So for the simplicity wise, I included here only non-skin cancer. So most common cancer is lung cancer, followed by colon cancer, breast, uterus, and prostate. Again, when you see at this list, you may think that prevention may be actually very beneficial, because most of the cancers in this colon may be either prevented by avoiding certain lifestyle choices, or be discovered relatively early in their development, secondary to screening techniques. But again, lung cancer rates may dramatically decrease if the smoking dangers will be eliminated. But again, this is most contemporary list. You may find something different from different sources, but again, lung cancer dominates this list, and most of the time you see it's topping the list of cancers. When you look at female and male distribution of cases of cancer, prostate cancer dominates for male patients, approximately 25% of cases discovered in a year, and breast cancer for female patient, approximately again 26% of cases discovered in a year. But for both male and female lists, the lung cancer will be second and colon will be third. So because breast and prostate cancers are so gender specific, they don't make to the top of the list, and when we're looking at general population, again, lung cancer is the most common one. Diagnostics. Again, this is a general overview of diagnostics for cancer, and the main concept with diagnostics is the early treatment. Using diagnostic for early treatment, sometimes days can make difference for the surgical excision, let's say aggressive colon cancers, and usually treatment should follow diagnosis very rapidly, very promptly. And prognosis is the best if treated early, because remember, if you lose time, you may let the cancer to spread. Exceptions are again skin cancers as basal cell carcinoma or squamous cell carcinoma, but those are exception cancers, and small delay in treatment may not be that instrumental or may not be that significant if we compare it to other type of cancer. Again, when we're talking about skin cancers, we exclude malignant melanoma, which may be very deadly and may require rapid, very prompt treatment. When there is a suspicion, the biopsy is recommended. Sometimes the cancer presentation will be so obvious, so already the patient will be scheduled for removal. In some organs, presence of the tumor or neoplasm, regardless it's malignant or benign, may be having very drastic consequences, and removal will be warranted even without discovering what it is. And most of the time, most of the tumors, regardless malignant or benign, will be removed at some point. Routine screenings may be helpful, and by screenings we again breast cancer screenings and colon cancer screening with routine colonoscopies, and we'll talk about the screening guidelines about those diseases when we talk about them in particular. But again, screening can be very helpful. Prostate cancer screening is becoming more and more controversial, and I will talk about it later in the course. General signs and symptoms of cancer. Pain is one of the hallmarks of cancer, unfortunately, and patients with diagnosed cancer, and especially metastasized cancer, may have significant amount of pain and may require very aggressive pain management and introduction of unusually high for other pain presentations doses of opiates and other pain control medications. So if you work on cancer ward, you probably will agree with me that the medication may be dispensed quite often and in larger doses than, let's say, if you compare it to even such high pain management floors such as orthopedics. Obstruction may occur, and by obstruction we are talking about obstruction of the blood vessels or obstruction of a duct or obstruction of the colon. In this case, obstruction may be a relatively good thing, because obstruction may cause symptoms and signs that will lead to further examination and discovery of the tumor. However, obstruction may present with very critical conditions and may be developing quite rapidly, and the obstruction need to be addressed also very quickly. Hemorrhage is another consequence of the cancer, and hemorrhage can be developed secondary to disruption of the vessels and invasion of the cancer, as well as most of the malignancies are highly vascular, and angiogenesis is rampant in these structures, and even small manipulation will cause bleeding. Depending on the size of the tumor, the amount of hemorrhage may be very significant, and patients may present with chronic anemia secondary to this. So patient may be asymptomatic at the time of the onset of disease, but may have anemia as a sign of cancer. Anemia may be warranting for a very thorough examination, and unexplained anemia is always a red sign. You cannot say this patient is old, that's where they live, and their hemoglobin is 9, so they're fine. Again, old and young are relative terms. Anemia, meanwhile, or hemoglobin levels are not. So again, if your anemia, your hemoglobin levels are lower than your guidelines, your lab guidelines, so it definitely warrants you to for further evaluation. One of the common evaluation strategies will be to re-examine patient for renal disorders, which may be sign of aplastic anemia, but in this case, when a patient may have a cancerous growth, one of the common strategies is evaluation of the GI tract to look for tumors or malignant polyps that may present with slow bleeds and overall slow reduction of hemoglobin level. So at this case, in both cases, if it presents like anemia of chronic disease, the size of the cells and the color of the cells may be normal, but the amount of the cells abnormal. So anemia of chronic disease may be actually signifying the cancers, especially the cancers of GI tract. If cancer is invading bone structures, it's quite possible that patient will present with unexplained fractures, and which may be sign of metastasis and bone invasions, or in case of osteosarcoma, this definitely will be one of the signs of presence of the primary tumor. Infection secondary to suppressing of the immune system are quite common, and one of the key visual characteristics of the cancers will be cachexia when patient losing weight, and cachexia occurs secondary to increased metabolic demands of the body, and if which is secondary to increased metabolic demands of the growing tumor uncontrolled. So your patients may have even sufficient caloric intake but still lose weight. At the same time, patient may present with loss of appetite, and in addition to loss of appetite, patient may have cachexia secondary to increased metabolic demands of the tumor. In this case, we can prescribe patients some pharmaceuticals that may contribute to increase of appetite, such as Megace. To complete this presentation, I would like to talk about cancer treatments very briefly, and there are different treatment modalities for cancer. You can see in your patients the treatments have numerous side effects, especially chemotherapy, radiation, as well as hormonal treatment, but don't forget that these are life-saving, last resort treatment. So some of your patients may focus on side effects and be resistant to receive the treatment because of that, but however, your job is to explain the benefits of the treatment as well as the side effects. What I'm talking about is the concept of informed consent, means we don't give any treatment in any condition without patient or patient's family if patient is not able to make decision for treatment. So the treatment, surgical excision may be very successful modality of treatment if it's done early in the timeline of the progression of the disease. if the cancer is metastasized, surgery may take a palliative, and by palliative I don't mean the end-of-life role, but the palliative role, which may reduce, let's say, compression on vital organs or reduce the size of the tumor. But at that time, surgery may be followed by chemotherapy and radiation. Chemotherapy is a systemic treatment, and in addition to attacking the primary tumor, it may also affect the metastasis. Again, the details of this will be in subsequent chapters and lectures, as well as in your pharmacotherapeutics course. Radiation is a local treatment, and radiation is local targeted treatment, which may be of the purpose to shrink the tumor, or it may even be a palliative treatment to prevent cancer from spreading. Radiation techniques improved vastly within the last few decades. To give you an example, when we talked about Henrietta Lacks' case, in her case, the cervix was packed with radium, and it's not seeds, but it's like a packing with the gauze type of material, and the patient was sent home. Today's radiation treatments are highly targeted and focused, and that may affect only the tumor itself. But again, radiation has all the side effects, and one of the most visible ones will be the radiation burn you will see on the patient's skin, as well as it can affect and be actually carcinogenic for the staff in the hospital. And at that time, of course, strict radiation prevention, radiation exposure prevention techniques should be utilized, and staff should be protected. Hormones is one of the common modalities of treatment, and hormones can be used for breast and prostate cancer. As you know, most of the breast cancer are estrogen sensitive, and most prostate cancers are testosterone sensitive. So by increasing the amount of counter hormone, we may reduce the size of the tumor. When we're talking about prostate cancer usually is not an aggressive disease, but it can spread relatively slow. So at that time, some patients, and usually it's depending on patient age, comorbidities, may opt out for hormone treatment. At that time, patient given doses of estrogen, which keeps the tumor size under control or even may shrink the tumor. Most of the time, male patient will experience the side effects related to excess estrogen and may have gynecomastia, hair loss, and other related conditions such as thinning of the voice. But again, the decision is usually made after a thorough discussion with the patient about the modalities. Usually younger patients may opt out for more radical treatments such as surgical prostatectomy. In breast cancer cases, hormonal treatments can play palliative role, and treatment with testosterone is fairly common if it's a palliative care and it's something non-operate, but the tumor is not feasible to operate at that time. Giving testosterone may keep the initial tumor as well as the metastasis from growing or growing rapidly, which can buy some time and be a type of palliative treatment again. This concludes the cancer or neoplasms lecture. Please again contact me if you have any questions, and I will see you next time, and hope you will enjoy the next lecture. Bye.